So I want to introduce myself. I am Anthony Salas, and I am the Event and Membership Manager with Welcoming America. And again, formally want to welcome you to today's webinar titled All In, the Shift Toward Inclusive Emergency Management. And it is being presented for us today by the Institute for Diversity and Inclusion in Emergency Management, or IDIEM. And before we get started, I want to just do a couple of quick housekeeping items for you. We are going to run for a total of 90 minutes, with the last half hour being some time for a really good, robust Q&A. So if you can join for the full time, we would love to have your engagement. But if you cannot, just want you to know that this is being recorded, and we will be sharing out the full recording after today's presentation. And to that, if you have any questions as we go forward, there is the chat that you're all using now to let us know where you're joining from. Use that same location and let us know if you have any questions. Enter them there, and again, we're going to get to those toward the end of the full presentation. So with that, it is my great pleasure to introduce our speakers who are joining us today. We're being joined by Chauncia Willis, who is the co-founder and CEO from IDIEM, Antoine B. Richards, the senior advisor also with IDIEM, and Greg Hodkin, who is the CEO of Peace Building Solutions. And again, we're very excited and honored to have them joining us for this discussion. And I'm going to go ahead and turn things over to Chauncia to get us started.
All right. Well, thank you, Anthony. What a great introduction. And I am so excited. I can't believe all of the different cities and locations represented here. This is going to be an awesome event today and an awesome discussion. And I'm so encouraged. Let's go ahead and jump right into the slides. And we'll take about 30 minutes to go over all of these slides. And if there are any questions that come from the information that we discuss, we would love to hear from you. We'd love to hear your questions and provide you with as much information as we can so that this is meaningful for everyone. First slide, Anthony. Okay, so today we're going to have a great discussion. I will be talking specifically about what it means to embed equity in decision-making as it relates to disasters and how we can lead from behind. Antoine will be covering community vulnerability assessments and the social determinants of health, and Greg will cover innovative approaches to reaching immigrant and refugee populations. Great discussion to come. Next slide. So our organization, the Institute for Diversity and Inclusion in Emergency Management. As Anthony said, I'm the CEO and co-founder. I have about 21 years in emergency management. However, some people that are going to be speaking later on today, specifically Ella Stanley, have twice that amount of experience. And we wanted to make sure that for this presentation, we provided as much experience and great lessons learned to everyone participating. So a little bit more about our organization. We focus on changing people's lives by improving their disaster outcome. So we work with departments at all levels of government and community organizations of all types to provide equitable and inclusive strategies in disaster preparedness, response, mitigation, and recovery. Our goal is to ensure that resilience is had for everyone, not just a few. Next slide. We're going to attempt to provide some really good answers to some of the questions that we're asked frequently. For example, what is equity? Where does bias even exist in emergency management and disasters? And why does it even matter? And how can I, as a leader, lead with equity as a priority? Next slide. The difference between equity and equality. Often we'll hear the reference to equality when it comes to emergency management. Well, equality is really saying that we want to do the most for the most. And of course, when you do the most for the most, you're leaving out those who may not be in a position to have access to all the resources that the most have. They're not in the mainstream and potentially have been marginalized. So equity refers to understanding the needs of your community. Equality is giving everyone a shoe. Equity is giving everyone a shoe that fits. Next slide. Decision making, how to influence leaders. So this is a great example of the innovation that is available for emergency managers and communities of all types. Leading from behind. This particular question of how to influence leaders came from a discussion within the Welcoming America coaching session that we provide, and to really get involved with the Welcoming America coaching and consulting sessions provided by our organization, IDEA. You want to contact Welcoming America's director, Melissa Bartolo. But this question came up from some of the communities who were concerned that they had no way to influence emergency managers in their actions as it related to the most vulnerable communities. There was a sense that there was no way to really influence the decisions being made by emergency managers and those who are providing disaster response. So the recommendations that we've come up with are really about leading from behind, creating opportunities to offer information without necessarily being the person or organization that's in the seat to make those decisions. So these are some of the recommendations. Ensure relationships are built with various organizations and nurture those relationships. The last place that you want to meet is on the scene of a disaster. You want to know who's in your community. You want to have those relationships established, and you want to be inclusive about establishing those relationships. And those relationships will influence decision making. Also, when possible, provide data to the emergency managers and those who are making those key decisions. One of the most influential ways to influence a decision is to provide the data, to provide these statistics, to make something very clear and validated using data. Also, we want to ensure there's buy-in from the leadership, and making sure they understand what equity is, and understanding that equity must be prioritized so that many community members can receive the benefits of equity. Further incorporating lessons learned from other organizations and making inclusion of all community members a priority. And finally, ensuring that we are using behavior modification techniques to combat unconscious bias, because bias clouds our decisions. We have already been somewhat acclimated to various stereotypes about people, about organizations, and it's a conscious decision to combat bias, because that bias can influence decision making. Next slide. Disparities in disaster. Disasters don't discriminate, but people do. So in many cases, people are not receiving the level of service from government because there's a level of bias built into the disaster response. And we've seen it over and over again, and we saw it with COVID-19 as well, that disasters the response can be biased. And when there's not a focus on equity in disaster response, in disaster management as a whole, people do not receive the best outcome. And in fact, when it comes to recovery, the outcome is often delayed and the resources are not provided in a timely manner. So we can talk more about that as we go throughout the event today, but there's definitely, unfortunately, a defined impact by not focusing and prioritizing on equity. Next slide. Bias in emergency management. Many have said that, in emergency management, I've been in this field for a long time and I've never seen any bias. And, based on the systems that have been created in America, we know that bias exists in every area, every facet. And to suggest that there is no bias in emergency management would be false. We know that the data shows that. And so we have to specifically work each and every day to address the existing inequities and to understand that many communities are dealing with the impacts of continuous bias in multiple different systems, whether it's healthcare, whether it's law enforcement, banking. I mean, there are disparities in every area, and they must be addressed to really forge the way to a better outcome. So we need to address the implicit bias and the structural racism that exists, and also understand the history of bad disaster policy, but also the history of the disparities in treatment when it comes to disaster management. Next slide. So when someone questions whether or not structural racism has an impact on disasters, the answer is yes. And this slide really demonstrates why. Within the field of emergency management, the leadership made up of leaders from all across the country are 82% white males. This is important and this is significant because when you're making decisions, if there's a lack of diversity in the room where decisions are being made, those decisions will benefit the decision makers, not necessarily everyone that is represented within the community. And we know within America, our communities are very diverse. And so when those relationships have not been established within the communities, we don't necessarily receive the information that's needed to develop programs and policies that will be beneficial and equitable for everyone. In fact, many programs have been created that are harmful to the communities that we serve. Next slide. The history of bias in disasters. The history goes on and on. And one of the areas that we'll probably need to add to this slide is the COVID-19 response. We know that during the beginning of the COVID-19 pandemic, we knew immediately, I would say even before we had a pandemic, but we knew immediately that there was a significant impact to our Black and Latinx communities. And unfortunately, there was a delayed correction. So even today, we see that 40% of the deaths that have occurred from COVID-19 have been from people of color. Also highly impacted, significantly impacted, have been our indigenous populations. And it's not because these different groups, it's not because of not eating well or not, understanding that, certain food groups might have an impact on your health. It's really not about that. It's about the existing inequities. It's about understanding the lack of access to quality healthcare, the lack of access to healthy foods. The current and existing conditions impact the response and the outcome for a disaster. So many of the existing vulnerabilities are exacerbated in times of disaster. So as emergency managers, we must be aware of the existing disparities and address those in our emergency planning, and also understand that our policymakers must be aware of what's happening within the communities and identify in advance what those vulnerabilities are that could impact the outcome of a disaster. So, next slide. As we talked about a little bit before, there's a definite need to understand conscious and unconscious bias. And we won't take a deep dive into this today because it goes along with so many other facets of bias. But it's important to provide training within each organization that will allow a behavior modification. The approach to planning, the approach to disaster response, and all of the other elements of disaster must incorporate an acknowledgement of bias and a desire to improve by including equitable strategies. And so that's really the goal of our organization, is to ensure that we're having better disaster outcomes, especially understanding that climate change will make disasters much larger, much more costly, and much more frequent. I mean, here we are in November, and we just had a hurricane come through last night. That's going to become the norm. We're in the middle of a pandemic, and that's going to become the norm. The pandemics, unfortunately, this isn't the last one we'll see. So climate change is real, and the most vulnerable communities will be most impacted by climate change. So we need to make sure that we're doing all we can now to begin to embed systems of equity in everything that we're doing. Next slide. Why does it matter? Equity really provides the assurance that all communities will have access to programs, funding, and resources to make their lives more resilient. It's about resilience, the ability of a community and an individual and a family, the ability to bounce back after a disaster. You want to be positioned with a relatively high resilience quotient. And unfortunately, our most vulnerable communities that have been marginalized, that have been redlined, that suffer from all manner of disparity of treatment, unfortunately, the bounce back ability is very low. And it matters, especially when it comes to decisions being made as a result of disasters, but also considering policy creation and programming for communities. Next slide. So this is the ultimate function of each of these specific areas: diversity, inclusion, and equity. We want everyone to understand that they have a role in disaster management. They have a role in understanding the emergency management cycle and participating in it. And that's significant and that's important. Next slide. Operationalizing equity requires empowering and adding new diverse voices that have been excluded to participate in the emergency management decision-making process. So we must change our existing practices. We have to be open to that, because changing what is currently existing within our emergency management enterprise and how we operate within our communities will impact the outcome for millions of people. So we must integrate equity into existing practice and prioritize getting resources to those who are most at need. So operationalizing equity is about looking for opportunities to incorporate diversity, to incorporate inclusion strategies, and to prioritize equity. Next slide. When equity has been fully operationalized, this is the result. We see that programs are developed that address the challenges of underserved groups, specifically those who are most susceptible to disaster. In response, it looks like everyone having access to resources, not just those who have access to transportation. And equity and recovery looks like everyone recovering wholly and fully in a shorter time frame. So, for example, with Hurricane Katrina, we know that there are many communities, even now, 15 years later, that have not fully recovered. However, there are other communities in more affluent areas where they have fully recovered, and not only have they recovered, they've been able to absolutely flourish. And that is inequitable. And finally, equitable mitigation, where we are making sure that our mitigation projects for infrastructure, even sustainability projects, making sure that underserved communities are made just as resilient and more risk is reduced in those areas. That's critical, and that would be equitable. Next slide. At this point, I'll turn it over to Antoine Richards, soon to be Dr. Richards, and I'm still going to call him Antoine. But I'll turn it over to Antoine to talk about community vulnerability assessments and understanding the social determinants of health. Antoine?
Thank you, Chantia, for that discussion. And I'm going to start this off just by saying that, when we look at vulnerability or resilience, we have to really take time to understand the factors that contribute to it. And a lot of that understanding comes from being involved within the community. We can't necessarily serve the community, or at all, we can't serve the community without the community input or understanding where those factors lie and why they are contributing factors. And that's going to vary by every community, by every disaster, and by every determinant that influences it. Next slide, please. So if we're looking here at social determinants of health are conditions in the environment in which people are born, live, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes. So we look at our economic stability, our social and community context, our neighborhood and environment. We look at healthcare and education. Next slide, please. When we break this down in more detail, it includes all of these factors: how available resources are, our access to education, to healthcare, transportation, public safety, our norms and attitudes, exposure to crime and violence, access to information. Language and literacy is one of the biggest ones here. Culture is huge. Our natural environment, our built environment, our work sites, schools, housing, and community design. All of these things impact the outcomes that happen for disasters and also impact our health. In emergency management, we tend to see that a lot of this lies right around public safety. What are police doing? What are fire doing? What is EMS doing? Do we have 911 communications that are available? But without paying attention to all of the other social determinants of health and how they interact with just public safety or emergency management, we begin to do a disservice to the communities that we seek to provide help for. Next slide, please. When we break this down into disasters, a new term kind of came out a few years ago in the emergency management realm, and it's called social vulnerability. This is not much different from social determinants of health, but they separate a lot of this into pre-incident, so before disasters, and post-incident. And here you see the same issues: access, our demographics, disability, language, disease, family composition, income, language and literacy, our living conditions, race, social connectedness. So those are things that we always want to look at when we start to think about our determinants of health or our vulnerability, because our outcomes rely heavily on this. So when we look at ways or approaches to interact the community within our decision making, or approaches or policies or programs that seek to improve outcomes, again, we're doing a disservice to the funding that we get for these initiatives, or the initiatives themselves, if we don't include every aspect of social determinants of health and social vulnerability. Next slide, please. So when we look at our vulnerability assessments, we have to understand where vulnerability lies within risk. Vulnerability is a component of risk. Assets and threats also influence risk. We have to look at vulnerability like we do our assets and our threats. And a lot of the models that we look at, such as THERA, they look specifically at the threats, they look at risk, and they look at assets, but they fail to acknowledge vulnerability. And acknowledging vulnerability really helps us look at risk-based versus risk-informed responses. And we need that paradigm shift away from saying, well, this was based on this outcome. We need to be informed about those outcomes, which is what social determinants of health and those different factors help us understand. Shantia did a fairly decent job of going over equity versus equality, so I'm not going to spend too much time on that, but we have to start to really integrate ourselves into the communities that we seek to serve. Windshield surveys have been a common tool that have been used, but again, these should be community led. When we do windshield surveys, we need to include the gatekeepers and the stakeholders of the communities because they can better identify areas of vulnerability. And I think that we missed the ball on that a lot. There are indexes that are out there, such as the Social Vulnerability Index and the CDC Social Vulnerability Index that are helpful for identifying vulnerability and providing vulnerability assessments. But then I also challenge you to also look at other community-based assessments, such as CASPER, which is also a CDC assessment, and that's the Community Assessment for Public Health Emergency Response. We want to make sure that we have community-based participatory research. This is a research approach that actually involves the community in the research. A lot of times we do research on the community and then we leave the community afterwards. There aren't solutions or programs that come out of that. We need to go ahead and make sure that we focus on community-based participatory research. So we identify within the community what the issues is. How can we best help? I always give this example, but in my neighborhood, obesity was an issue where I grew up, and they said, well, people aren't walking. The walkability of the city of this neighborhood is really bad. So the city invested millions of dollars in sidewalks. Later on, the community never used the sidewalks, and they said, well, we don't know why this didn't work. We put the sidewalks there, we put the money there, all of that good stuff. And finally, they decided to have a community town hall. Community members said, well, there's no street lights. It's not safe to walk. You would have been better off putting that money here or there. And that's what community-based participatory research is all about. And those really help solidify our vulnerability assessments. You can get a lot out of vulnerability just from including the community. Another one is evaluation. We don't evaluate a lot of our programs and initiatives. And these evaluations are kind of foundational equity assessments. We need to start including equity within our evaluations. And evaluation comes in 4 types: formative. So when we're planning a program, when we're developing our initiatives, process and implementation comes when we're actually implementing our programs. We put measures and monitors in place that say, hey, are we doing this equitably? Are we addressing vulnerability? And do changes need to be made within the program during implementation to ensure the best outcomes? We also need to look at the outcomes and the impacts when we do these programs to ensure that we've achieved the outputs that we set out to achieve, and that we've also achieved the impact that is necessary to say that we have the most profitable return on investment. Meaning that if we invest $1 million, how can we show that we got $10 million or $20 million out of improving equity or decreasing vulnerability to build sustainability in the process? And the last thing is an equitable review. We have to start looking at the policies and the programs that we're doing within our workplace, within our leadership, and saying, hey, these policies are not equitable. Did we include disabled populations? Is there something here for these populations or for these populations? And we have to do this with a fully inclusive mindset. So as we continue to move forward in our work, I hope that we start to continue to look a little bit more into vulnerability assessments and start to think about all of the social determinants of health that impact these outcomes. And with that, we're going to move over to Greg. I'm going to introduce him here. So Greg Hodgen is the executive director and founder of Peace Building Solutions. He graduated from Emory University with a bachelor's in chemistry and from Georgia State University with a bachelor's in history, a master's in political science, and with his doctor of philosophy degree in political science. Greg has been an advocate for improved outcomes. He has tussled with the Russians at the United Nations and won, and has defended and expounded refugee and IDP rights on the floor of the United Nations on 2 continents, which has also resulted in him having 2 machetes and 1 AK-47 shoved in his face while doing field work. So Greg is no stranger to fighting the good fight. We look forward to the input that he has here, and we hope that Greg can give us a little bit more about some of the best approaches to community engagement and building trust within the communities that we hope to serve. Greg, take it away.
Well, I don't even know where to start with that one. Thank you, Antoine. That was way over the top, but I appreciate it. Thank you very much. Good afternoon, everyone. I am Greg Hodgin, the Executive Director of Peace Building Solutions. Next slide, and we're going to knock this out relatively quickly. Unlike everyone else here, we do international work. We don't do work in the United States, but some of the issues are similar with respect to emergency situations and how to respond to emergency situations. Next slide. And to do that, we're going to discuss the Swedish chef. The Swedish chef, I know this is kind of absolutely bizarre, but here's the thing about this. Let's say that there is a disaster of some kind, and let's say that your house is destroyed by a tornado, an earthquake, a hurricane, whatever. And the Red Cross doesn't show up, no one shows up, the federal government doesn't show up. Instead, let's say that the Swedish chef shows up. Let's say that there's 50 of them. They all show up and they help to rebuild your house. Here's the problem. They don't speak your language. They don't know your customs and your culture. And even though they rebuild your house for you, they never ask you what you want. Let's say you're disabled and let's say that you're in a wheelchair. They build stairs in your house. Or let's say that you are, how to put this? Let's say that you are deaf. They install only sound fire alarms as opposed to the ones with light as well. Let's say you use power like, I don't know, every American does. They install European outlets as opposed to American outlets. One of the issues there, of course, is the fact that we have different outlets. And of course, if you've ever been to Europe, the bathroom's going to look a bit different, isn't it? There's no toilet paper. There's going to be a very weird device on the toilet instead that a lot of people don't know how to use. All they do is take a bunch of pictures and then they leave. Did they do something good? Yes. Did they respond to an emergency? Yes. Did they help you at all? Probably not. In fact, you might spend more money fixing all the stuff they attempted to fix and repair than they will otherwise. Hence the Swedish chef. I love the fact he goes bork, 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 and all that good stuff. It's a good point that when you're talking to someone from a different language, especially when you just meet them, you can't understand what they're saying. And if they don't even make the attempt to learn about you, how are they going to even understand what your needs and wants are? And a lot of international NGOs are that way. Next slide, please. When it comes to a lot of NGOs out in the field, a lot of international NGOs out in the field, one of the issues that they have is that they're still working on this very short-term emergency model. The idea that if we go out into the field and there's an emergency stuff going, let's say there's an earthquake in Haiti or something like that in 2010, and everything gets knocked down, they'll be back up on their feet in 6 months. The problem is that doesn't work anymore. We have what are called protracted emergency scenarios, where people are actually stuck in IDP camps. An IDP stands for internally displaced person. In IDP camps for a decade, if not more. Refugees, the average the average lifespan of a person refugee, or the average time that someone spends in a refugee camp is about 7 to 10 years. If they're lucky, sometimes they spend half of their lives in these places. Children are born and they actually have generations of people in refugee camps. So it's still an emergency scenario. It's still responding to an emergency scenario, but it can no longer be looked at as this very short-term get in, get out, and be done. A lot of these emergency NGOs believe that they can go in without talking to the community anymore. Unfortunately, there's an issue with that, which is you have to be there for a lot longer. And because of that, a lot of these guys walk in, they don't have a research department. They don't talk to anybody because everyone knows that you need tarps. Everyone knows that you need water. Everyone knows that you need food. This is a very white savior complex, neo-imperial, neo-colonialist worldview. And when a bunch of white people go to other countries, which is what usually happens, and they try to fix things which they don't know how to fix, or they don't know how to fix it locally, you have issues. So you see people kind of coming in with their ideas of what's wrong, and their ideas to fix it when the community has been there their whole lives, and they probably have better ideas than we do, which is why Peace Building Solutions exists. We sat down and actually looked over the research and realized that the research says to do one thing, but in the field, but no one does it in the field, so we chose to do that. Main point is you gather information, you go and you talk to the community, but not just the community. That is an abstraction, right? You talk to people. It turns out the first person who walks up to you who speaks English might not be the community leader. They might just be the person who speaks English. That doesn't mean that they're the ones in charge. Ladies, you of all people probably know this. The guy usually isn't in charge. It's usually the old woman in the back. The guy is the one who's brash and wants to talk and thinks that he's in charge, but it's the woman in the back, usually it's the old matriarch in a lot of these societies, are the ones who actually know who's married to who has how many kids, who's cheating on who. They know all this stuff. They're usually the ones who have informal power. They're the ones who actually adjudicate disputes. You don't know that unless you gather that information. And you don't know that unless you gain the community's trust by actually treating them as equals and not numbers on a spreadsheet. Once you gather all this information, you analyze the data. The idea behind analyzing data is, all right, the community said they need X, Y, and Z. How do we give them what they need in the most efficient, effective way possible without taking away their agency, and also by giving them the ability to empower themselves? When it comes to this especially, you see a lot of NGOs who say, oh, they need X, Y, and Z, we'll just do it for them. How about instead of bringing Westerners in, who you have to pay a lot of money for, why don't you just hire the community themselves? Why don't you ask them for their skill sets? Maybe they want to help. Maybe they want to get paid to help. In fact, most of them usually do want to get paid to help. Maybe they have skill sets that you don't have. You'll never know if you don't ask. Next slide, if you don't mind. So what we do is that, and we've actually already begun a pilot project in Haiti. We're actually trying to do a bigger one later on, relatively soon. The idea is that we actually begin the assessment with respect to research. We gather all the information. We're not on the ground for a day or 2 days. We're usually on the ground for several weeks. The idea behind that is to gain the trust of that local community so that we can respond to the emergency more effectively than anybody else. Once we do that, we come back, we build the intervention that's needed. Hopefully we can actually shrink that down so that we can do both of them nearly at the same time. And once we begin the intervention, the goal is to actually stay with and work with the community as equals. We don't go to a hotel that's 40 miles away and stay in an air-conditioned room that's $200 a night. We stay with the community. Because it turns out that when you break bread with somebody and you drink their water and you share food with them, you become a part of that community, and they will share more data with you because it becomes a nice virtuous cycle of you are showing trust by living with us. You're showing trust by giving you information. Even better, next slide, please. When it comes to a lot of these things, it's not just talking to one person. One of the things that we've learned is that you certainly split up the community by genders, and not just by gender, but you have a woman talking to a female translator who talks to the women in the community. The reason for that is, and I think most of us understand why this is, it turns out that women in patriarchal societies really can't talk about what's really needed when there are men around. Even people who are outside the community, they're afraid that something else might happen or there might be a backlash of some kind. So it turns out when we went to these places and we talked to these people, the men said we need X, Y, and Z. You can see what the men needed right here. And it was a lot of construction things. It was things for the community that was necessary. So agricultural tools, water systems, things of that nature. When we talked to the women, they said they needed two things: school supplies for the kids because school is starting soon, and shoes. We asked, why do you need shoes? We're not trying to judge or anything like that. We just want to understand why you need shoes. Don't you need uniforms? In Haiti, if you're going to go to school, you must have a school uniform, and they always, doesn't matter where you are, they're always dressed to the nines when you go to school. It's a matter of national pride. They said, we have the uniforms, but the kids have to walk 2 miles a day. They need shoes. And they said, can you buy us shoes? We said, yes, but we're going to do it in a very specific way. So we asked the matriarch, her name was Naomi. We asked Naomi, well, how many children are there and what kind of shoes they need? She said, hold on, pulls out a notebook, goes to every single one of the shelters, asks and writes down what she already knew, but she wanted to check anyways. And she got all the shoe sizes for everyone in that community. She brings it back to us and hands us the notebook. And we say, no, get in the car. We take her to the store. And the reason for that is because in Haiti, especially, I kind of stand out due to that. And you get what's called the blonde price. Blonde in French means white, but in Haitian, blanc actually means foreigner. And it has a bit of a negative connotation. Either you're trying to rob us or you're crazy, one or the other. The blonde price is usually 300 to 400% over what they would charge a Haitian. So we sent her in. And we told her, we only have this much in the budget for everything that you guys want. So the more you save, the more school supplies and everything else we can buy. She said, great, I understand. 45 minutes later, yes, she loved negotiating and haggling. It was hilarious to watch. After 45 minutes, she walks back in with a big, massive thing, throws it in the back of the car. We head back. She says, okay, how are we going to distribute it? And we said, it's not ours to distribute. This is your community. We are facilitators and moderators. We are not in charge. You distribute. She calls out each family. She hands out a pair of shoes to each one. Total cost for shoeing 100 kids, $300 US. When you do the research and you do it effectively and you engage the community and engage in bottom-up empowerment, not only do you do an intervention that's long-term, you save money in the long run. If you do research that's $50,000, you can save us $500,000 down the road when you go back to your donors because you don't have to ask for things that people don't need. And I think that's basically it for me right now. I'm sure I'll be taking stories later on, but When it comes to emergencies especially, we have to remember that, how to put this succinctly. When it comes to emergencies especially, every community has a lot of different stories and a lot of different people in it. And when you treat people like numbers on a spreadsheet, they will treat you as such as well. And that's it for me.
Outstanding. What great presentations. Thank you to our presenters. Antoine and Greg, you guys did a fantastic job. At this time, I'm going to turn it over to Anthony to introduce our panelists.
Great, thanks, Chauncia. And yeah, so we are going to transition now to a discussion and bring in a few of our closest friends here to become part of this. So I would love to introduce you to them now. We are being joined by Brittany Ford, who is a fellow with the Robert Bosch Foundation, and she's joining us from Berlin, Germany. We're also being joined by Zeman Zhao, who is the director of the Salt Lake County Mayor's Office for New Americans, as well as Ellis M. Stanley, who is the managing partner of Ellis Stanley Partners, LLC. And they are going to engage in a really great discussion now with Chauncia that she's going to moderate. But I also want to encourage everyone, if you have questions, please keep them coming into that chat, and we'll be moving into that shortly. So Chauncia, I will move it over to you.
Well, thank you. Thank you so much. I'm looking forward to this aspect of the discussion because everyone's going to give us their specific perspective in response to some questions that have been really crafted with equity in mind. So, hi Ellis, how you doing? So let's go ahead and talk about it. As I said, this will be a deep dive into understanding the perspective of the boots on the ground, our communities and community serving organizations. And we know that right now we're facing a very challenging time in America. And we'd like to discuss that and discuss some of the solutions. So with that, I'll turn it over to Brittany. And Brittany, if you could tell us a little bit about your background and what your experiences have been in disaster management.
Good evening, everyone. It's evening for me, at least. So it's about 5:44 p.m. It's very dark in Berlin by 5 o'clock, which I had no idea. So I'm Brittany Ford. I am currently a fellow with the Robert Bosch Foundation. And I'm researching public policy with a focus in migration and integration. I know several of you on this webinar from working over the years. Previously, I was a policy analyst with Lucas County in Toledo, Ohio. That was really recent until last month. And then I left to come and do this fellowship. And one of my roles at Lucas County for more than 7 years was to lead our local welcoming initiative, Welcome TLC, Welcome Toledo Lucas County. We went through the certified welcoming process last year and did achieve certified welcoming. And part of that was language access, as well as ensuring some level of inclusive emergency planning. So for us in Lucas County in Toledo, Ohio, that work started in pretty quickly after our 2014 water crisis, where the regional water system shut down for 3 days. It was national news, but maybe people didn't hear about it, but it was a big deal for us in Toledo, Ohio, and a big deal for the vulnerable communities that Welcome TLC engaged with. And very quickly, the emergency services department at that point realized that they had no clue how to do language access. They didn't have internal capacity or staff know-how to do language access. And they essentially did very limited translations, and only because the community was starting to come at them and say, like, we really need you to do this work. We really need you to translate some of the emergency communications. So after the crisis ended, after those 3 days, the local immigrant communities did an advocacy campaign with our local elected officials. And very quickly after that, I was brought in to help the emergency services department at Lucas County to develop some language access planning. And that included incorporating into our emergency operations plan. And it was a very high level policy driven plan. And so when COVID-19 hit in March, I thought we would very quickly pull that plan out and get going, even though it wasn't incredibly procedural. But unfortunately, it took us several days to get that part more mobilized. And so it took us actually a week in order to mobilize that part of the plan, which was not because I wasn't asking for us to get this going. So it was a disappointment, but at the same time, once we did get it going, I was in charge of coordinating language access for our emergency operations center during the response in partnership with our health department. And so again, they realized that they didn't really have the internal capacity. So they brought me in and asked me to coordinate that work. And so that did include utilizing Welcome TLC for our community outreach networks, because the other challenge for Lucas County's Emergency Operations Center and Health Department is they really didn't have those community partnerships established either. So I'll leave it at that, and we can kind of get into some of the other stuff, and that's my background.
Thank you, Brittany. Outstanding. Okay, so Ellis, if you could quickly tell us about your background and what your experiences have been in disaster management.
Thank you, Chauncia, and thanks to the other people participating. I'm delighted to be part of this from the listening side of it, learning a lot. As Chauncia said, I'm the old guy on the panel with 45 plus years of experience in emergency management, boots on the ground. As a practitioner, I started off in North Carolina, on the coast of North Carolina, went to Durham County, North Carolina, where Duke University Research Triangle Park is, North Carolina Central University, and then went to Atlanta, Fulton County. We had a little thing called the Centennial Olympic Games and a lot of other opportunities to participate and practice the practice of emergency management. Left there and went to a little town in Southern California called Los Angeles. Started their program in emergency management and retired after about 10 years there and went into the private sector. So I've been in emergency management quite a while. And one of the things, a little secret I'll let you know, is emergency management is not a one-way street. It's a top-down, bottom-up. It's a me-you relationship. And it is about relationship and leadership. And I'm delighted to share when we get into the meat of the discussion. Thank you.
Outstanding. Thank you so much. Yes, Ellis has a lot of experience and is specifically dealing with very diverse populations during disaster. Next, we have Z. Z, go ahead and tell us a little bit about yourself and a little bit about your experience with disaster management. You're on mute. Unmute yourself, Z.
Oh, I thought I got this down by now, but thank you, Chauncia, for the introduction, and thank you, Welcoming America, for inviting me to join this important discussion here. My name is Zeman Sao, and I direct Office for New Americans for Salt Lake County Mayor Jenny Wilson. I have no experience in emergency management prior to COVID-19 and was thrown into it the very early in March when the pandemic started, and realized really quickly that although we have worked with emergency management to put some plans together the year before while we were going through the welcoming certification process with Welcoming America, what we have in paper was not, did not prepare us or did we have the infrastructure to implement what we had put down on paper? And that was very evident. I just want to concur with everything that all of the presenters said early on, and that is that without getting input from the community, we will not be able to solve the problem. And I really appreciate Alice saying that is a two-way street. The top-down approach, which was what was implemented in the very beginning when we released health authors in written in a 26th grade reading level with no interpretation translation provided, doesn't work. So I'll pause there and happy to dig deeper into some of the experiences we had.
Outstanding. I'm so happy that you're here, Z, as well. We'd like to just go ahead and offer it up to the panel. We're going to provide some questions that, I really think will speak to the need to focusing on community engagement. So let's start there with Z. Tell me, what is your thought on why many community organizations don't receive the level of prioritization that is needed to really assist in forming disaster plans and implementing disaster response and recovery? Why aren't vulnerable communities prioritized?
I think that in a lot of emergency plans is written in the emergency plan that they should be prioritized. It's a matter of implementing those plans. And I think that oftentimes we check that box on the plan, but doesn't follow through with the work. A lot of speakers speak to the importance of building those relationships very early on. Relationships do not get built overnight. It takes time to build those relationships. I think one of the challenges that we face is that we often work in silos in the government system. Mm-hmm. We have Office for New Americans and the Office for Diversity and Inclusion. And we are tasked to really build those relationships with the community. And when emergency, and so that's kind of the silo, right? If they're doing it, then I'm in emergency in management might not need to do it because I just rely on that. That is their responsibility. And I think that is really important to know, because unless we help all of the departments and agencies within a governmental system to understand what community engagement is, what building those relationships is, we're going to really miss the point. So I think that we recognize, and the other piece of it, I think is really important too, is making sure that emergency management bring in resources that is within the government agency. Our office has all of the relationships. We know exactly who to call, but early on in the response, we weren't utilized. And I think that was another lesson learned.
Great response. Lessons learned. Ellis, do you want to have a response?
Yeah, I do. Let me first say ditto to Z. She's exactly right. Relationships is a process. It takes time. And I'll be the first to admit, emergency managers, many of the emergency managers come from a guns and hoses background. Put wet stuff on the red stuff, or direct traffic and this sort of thing. And they are focused on the response phase of it. Emergency management is a whole cycle of activities. And first and foremost, you got to know and understand your community. And unfortunately, many emergency managers are, as he said, siloed into areas where they are putting out fires constantly and don't have an opportunity to do that thing that's necessary. So when I say two-way, we've got to find a way for the community to even knock on the door. I've always worked from a philosophy of it's not about us without us. I can do the best plan about anything, but if I'm doing a plan with folks with disabilities, and folks with disabilities are not sitting at the table helping me to develop that process, then it's not going to be something that they own. We have to do some new learnings, if you will. Silo mentality is not just in government, it's in universities, and it's in everywhere. And that's not to say being siloed is bad. There are good things that go on in these silos, or they wouldn't exist, hopefully. But the opportunity for us is how do we link these silos in a way that 1 and 1 is 3? How do we link these silos to become a force multiplier for the community and help to mitigate some of these issues before they become a particular problem? So I think that's one of the ways that we can deal with it. It's about leadership, and I'll talk about that a little later.
Outstanding. It really is about leadership, and it's about making sure that we are taking the time to prioritize all of our communities. Brittany, you talked a little bit in the beginning about the emergency organization not really utilizing its language access plan. What can be done to ensure that the emergency management leaders are fully aware and able to implement these plans and really make language access a priority?
So, that was a really disappointing experience because like I said, it took a full week to for our policy level plan to even be implemented. And so, you know, I think in hindsight, the person that I specifically wrote the plan with was the emergency planner for our emergency services department. He was not the decision maker when the emergency operations center was mobilized. So I think, you know, and unfortunately, sometimes those decisions of who's going to be leadership are different than what you expect. And so I thought that we had the right people bought in. And in reality, the people that were decision makers during this, you know, unforeseen crisis were different than I anticipated. And so it took us that week in order to get to that new leadership to basically say, like, you have to do this for lots of reasons, including federal civil rights reasons. And one of the ways that we did that is by utilizing our partners in the community that are advocates. So when I was not getting my emails answered or my phone calls answered, to those new decision makers or my peers were not, we utilized our contacts in the communities that are advocates that could say, you have to do this. And so that was one of the ways that we were doing it. I think, you know, I think the other thing I would just say is, obviously we were in the midst of a crisis at that point. And so we had to, you know, get to the top as quickly as possible. But over, you know, in preparing for the next emergency and preparing for resiliency, I think also making sure that as many people in leadership know about these plans that exist and why they're important.
Mm-hmm. Outstanding. Ellis, you want to say something?
I do. The process of planning is more important than the plan itself. Establishing those relationships, knowing who's on first, et cetera. And you do your best planning on blue sky days, not gray sky days, because in the midst of a disaster, it's not the time. Nobody's going to get buy-in, et cetera. You can come up and say, this is the best widget in the world, but if they hadn't had a chance to use it, incorporate it in their process, develop a learning of it, it's not going to be utilized. Doesn't matter how great it is. And in a situation like a pandemic, we always look at AARs, after action reports, and see what learnings we can get out. I'm suggesting an OAR, an ongoing action report, because sometimes you have to stop in your place, exhale, and see where we are. The plan is only a guide. You may have to actually adjust the plan. There's nothing wrong with that. It's a document. The disaster didn't read the plan, so why are we so set in making it so locked down and ironclad. We have to be flexible enough to say, this can be done differently or better. There's more than one right answer to accomplish a task. So Brittany, it's the process is more important than the plan itself. And once you engage this, even when there's a transfer of leadership, that relationship should continue, and you're part of you're at the table. You're at the table. That's where it's important.
Being at the table and having that representation. What has been the challenge? And this question goes to really to everyone. What has been the challenge when it comes to coordinating and providing outreach to immigrant, migrant, or undocumented communities? What has been the challenge? And what is the potential solution?
Well,
I'll take a step at it first. I think a challenge in our community, especially when you're dealing with immigrant, undocumented, and mixed status families, is fear. And we have to really bridge that. I mean, I think that is the biggest elephant at the table in the beginning, is that we got to understand who all of our residents are within the community and all the families, including those who are undocumented. And so I think that was the big challenge for us, in addition to translating the materials, making sure that it's written in a simple language format, but it's building those relationships and making sure that you build those trust with trusted community members so that they can send a message to the constituents that they know. For me, as a government agency, or for the mayor to release a statement, is very different than, say, a priest in a certain church releasing the information. And again, I think that is where the point is, and where those relationships come in. Early on in the pandemic, well, not early on, in the midpoint of the pandemic, we really pivoted from what we were doing and what we have done in the past, because we knew that it wasn't working. We have seen the spikes in cases jump up for the Hispanic community, where they represent 14% of the community. The infection rate was at 45%. And that caught the attention of the leaders, and that we really have to pivot. We have to do things differently. We have to communicate differently. We have to outreach to the community differently. And how do we do that? And the way we did it is exactly what we talk about. We go back to the community and ask them, who are the leaders that you would trust and listen to? We start producing videos, not from the governor or from politician. We ask faith-based leaders from all faiths to create a video to talk about why you should wear a mask, why this pandemic affects everyone. And that has really made an impact in the community. We have seen the rates now moving from 45% down to 25%. And I think that is the key to it, is that identifying those community leaders that are trusted in the community to be the messengers in the message to a community.
Mm-hmm. Outstanding. That's an outstanding example of why it's important to engage the community really as often as possible, and engage the right members, because we understand there has to be trust in order to really form those relationships. And Ellis, I'll draw upon your experience. I know when you were the emergency manager for Los Angeles, you dealt with a wide variety of communities. What was the outreach like, and what were some of the techniques that you could provide to our audience today that you deem effective?
Well, first of all, and thank you, Chauncey. I think one of my greatest learnings was that translating language is one thing, translating culture is more important. You know, just because you speak Spanish doesn't mean everybody is of the same culture within that Spanish-speaking population, or you speak Chinese or you speak Japanese. You have to understand the culture. And I guess my biggest learning was to listen twice as much as I talk. Go out, get out of the office, go out into these communities and see what their issues are, not what mine are. I have certain ones that by law, by statute, I have to do. And that's that equality thing. You know, I got to build this plan, but the plan needs to mean something. And until I started getting out into the trenches, getting out into the streets and understanding that what I wanted to provide them, they didn't need. They needed something else. They wanted something else. I'll take care of me if I've got this. And by simply there's a little exercise that you can do called gaps, gives, and gets. You know, you sit down around in a round table with community folks, you bring public sector to the table, which would be me, you bring the private sector to the table, and you figure out what the gaps are. And then you say, well, how can I fill these gaps without making it a bureaucratic red tape situation? An example was in Boston. The Boston Pop said, "I got buses, I got food, I can do everything to help my community, but I can't get through that traffic stop out there because that rookie cop was told keep everybody out." So the police is saying, "Okay, I can handle that. Here's a credential, you can get through this." Or you got a building on fire, and in the next building over, you got methyl alpha bad stuff in it. I need a credential so I can get through the fire line to shut off the methyl alpha bad stuff. Get out of the office, get into the trenches, and listen, see what their issues are. And when we talk about the listening and we talk about diversity, I asked the question, how do you add 1/2 and 1/3? You find the common denominator, whether it's young, old, black, white, rich, poor. You find the common denominator and you listen and see how you can come to a solution for the potential problems you might have.
Outstanding. Brittany, do you have anything you want to add to that when we're specifically talking about ways to provide outreach in diverse communities and to connect?
Yeah, Alice, I just want to thank you for your incredible experience and wisdom on this webinar, because I could probably listen to you the entire time. But you know, with I think one of our challenges in Toledo was that you know, our initiative, Welcome Toledo Lucas County, really was a partnership of organizations versus individuals. And so, you know, we always had multiple, you know, at least one layer removed from actual community members. You know, and that's fine, but it also creates some level of you know, a disconnect to sometimes like make sure that we're meeting everybody's needs and not just say the organization's needs. And I know like in the really early beginnings of the pandemic response, we also recognized that there was some very big issues around the digital divide amongst many of the people within the immigrant community, and making sure that you know, we're getting this information out in mediums that actually they need, you know, and that can mean a lot of different things for lots of different community members. And so it's, you know, no one size fits all for every single community and every single community member. And so it's you know, that trying to constantly try to meet as many needs as possible can be a big challenge as well.
Mm-hmm. Excellent response. It's absolutely true. It can be absolutely overwhelming, but it's worth it. It's worth it to do it and to make that extra effort. And as Ellis said, we got to get out of the office and connect with our communities. It's a priority. I'd like to thank all of our panelists for participating in this session. At this time, we're going to go ahead and turn it over to Anthony, and he's going to answer some of the questions that have come in related to our events today. So thank you.
Thanks so much, Chauncia, and big thank you, Brittany, Z, and Ellis. That was a great conversation. So what we're going to do now is we're going to open it up to not only them, but our other speakers as well, and move into some of the questions that we have been receiving from you, our attendees, and hopefully get to as many as time allows. As I mentioned at the top, we are going a little longer today because we wanted to make sure we had a very robust Q&A portion. If you're able to stick with us for a while, please do. We'd love to have you. If not, again, this is all being recorded and we'll be sharing it with you after. And keep your questions coming. We'll get to as many as time allows. But I want to start with one question here and trying to kind of pull in various different groups, because I know we're talking about a lot of different communities through the discussion here today. And I think this question kind of maybe pulls all of them into one. But can someone maybe talk a little bit about how we make sure people that have the most disparate impact? So examples given are like individuals with disabilities, women, people of color, LGBTQ plus community. How do we make sure that those are individuals that are represented, and a lot of the practices that maybe you were a little older in method are updated, especially in things like hiring and promotion, things of that sort. So can anyone give us a little bit of a response to that?
One of the things that IDEM is looking at doing, there's always this thing where nobody has experience, nobody has done this, done that. So we're looking at how can we provide access by students that are in college studying emergency management or studying something else that want to get into emergency management, and provide opportunities for internship. When I was in LA, and I think interns ought to be paid, being a father with kids that were in college. I think that's appropriate. I would get private sector to fund that internship, and they would do 3 or 4 days in emergency management and a couple of days in the private sector office. So those are ways of doing it. Aside from that, one of the ways that I found this real inclusive is to ask the areas of interest, population of disability, ask them to participate in an exercise. And more importantly, ask them to develop an exercise for you to participate in. You know, kind of, these are some of the issues that we're having and we want to do it. And when you're doing that, make sure that the caretakers are part of that process. That again, the process of preparedness is more important. So actually going out, getting them to even help you design the exercise, and make sure that you focus it on the issues that are important and how it's going to relate to the overall response and recovery.
Mhm.
Great, thanks, Ellis. Does anyone have anything to add to that?
Greg?
So we actually wrote in our bylaws, so it is legally enforceable that we have to hire refugees and IDPs as a certain percentage of what's going on. And we also make sure that our HR department has been told to hire non-white people, basically. The idea is that you hire people who have been through the same things that we are working on, and the people who have those experiences can share them. We count refugee experience as experience. So if you've been in a refugee camp for 10 years, that's still experience. Just because you didn't go to school doesn't mean that you don't have anything to learn or show, right? And we also kind of discourage people who have, we kind of discourage hiring people or who have been through the normal system, because the normal system kind of trains you in a certain way. We don't want those people. We want people who have done different things. We actually have a problem because we have a lot of people who are like, well, I did Peace Corps and that's usually a strike against you. Usually in the international community, Peace Corps is a thing that people really want. We don't want that. We actually, unless you went there and you were disillusioned by it, it's a different story. So when it comes to hire these people as well, when you go into the field, hire them too. For me, from an international perspective, it's much easier because paying a Haitian a living wage in Haiti is much easier than paying a Westerner a living wage, right? So I can hire more Haitians. The Haitian living wage, and by the way, we don't sit down and just hand them money. We negotiate with them, and they negotiate with us what they consider a fair wage, which is hilarious because they thought they ripped us off because they were getting $10 an hour. And I can get into all the issues with pay scales with respect to that later on down the road. But they negotiate with us, we pay them fair wages. But we hired many more Haitians, and they were people that had the skill sets that we needed. Do that. If you need a translator, why are you hiring someone from outside the community to do it? Why don't you hire someone inside the community? Pay them, because not only are you empowering that community, you're giving that community money for that local economy as well. And that money gets recycled in that local economy. And those people are able to actually, because you're able to, what's the joke I heard? Oh, it's always the idea that pull yourself up by your bootstraps. Well, what if you ate your bootstraps 2 years ago and there are no bootstraps and there are no boots and there are no shoes and your feet are falling off? Like, you can't do that, right? So when you hand people this stuff, and the thing is, people go, oh, poor people know how to spend money. No, they know how to spend money much better than rich people do, because they know how every dollar counts, right? So each of those dollars goes a lot further that way. That's me talking. I'm going to go off on a rant, so I'm going to shut up now.
I love to hear you speak.
Excellent. Well, thank you both for that. I want to move on to another question here. And again, one that has been asked in a couple of different ways. So I'm going to try and combine this here, but it's really talking to getting some advice and guidance on how to get support and buy-in from stakeholders within communities, particularly like senior leaders, individuals like that. How do you get that buy-in and nurture that within your own community? So again, open it up to anyone that can talk to that.
So I can say a few things. I've done a lot of community engagement when I was in Toledo and worked for Lucas County with our local disability rights community. And I was also Lucas County's ADA coordinator for several years as well. And I can just concur with what Ella says, that I think that a lot of people from the disability community, at least in my experience in Toledo, really want to be a part of the process and want to be a part of the solutions because they know that emergency response is so incredibly important to their livelihood. And so I know in Lucas County, we had I think we called it a functional needs advisory committee that was operated in partnership with many of our disability rights partnering organizations. And there's a lot of diversity within that community too. So it included our developmental disability community, our physical disabilities, our deaf community. And so really understanding that there's a lot of diversity within all of these communities as well, and making sure that you have representation from many of the partnerships. Unfortunately, my experience in government is that I think that community engagement and community outreach is often seen as not mission critical for service delivery. It's something kind of on the side, or maybe it's compartmentalized to someone like me who likes to do this work. And so it's not really seen as a part of, job descriptions or agency or department operations. And so I think that that's a real frustration for me. And I would encourage anyone who is in leadership in government to really see that community engagement and community outreach is critical to all services and not just those community relations departments. I can help you when I was working at the county only as much as you would be willing to take on, so I could help every single department to do their own community engagement by helping them connect to those people in the community. But I can't do that work for you. So I think that it's incredibly doable with the disability community or the senior community, or even many of the immigrant organization leadership organizations. They want to come to these meetings, but you have to have them, and you have to be willing to spend the time to build those relationships.
And Anthony, let me add one thing too. I'm a senior citizen. Most senior citizens don't want to be thought of as old folks. And sometimes you have to engage, empower, and reflect your community from a different perspective than what you're actually going to. You don't want to say, hey, can you senior citizens help me with a disaster plan? You may want to recruit them from the standpoint of what was it like 20 years ago, 40 years ago, when this disaster comes through? How did you all respond to it? That may be in the mitigation phase of things, and find out what they are interested in talking about. And then once you develop that relationship, then they are more apt to participate in the process of planning for emergencies and disasters, and actually can now tell their neighbors why it might be important that you wear a mask, why it might be important that you do this. So, you have to kind of engage from where they sit, and I'm just picking on senior citizens. It could be any group within your community. People poor folks. I think Greg said they're more resilient than anybody in the community because they have to survive every single day, and we can learn a lot from them.
Mhm.
Absolutely.
Um,
Go on, Zeke.
I just want to chime into the conversation here too, that we have to also pay attention to the experience of community leaders and how much they are also giving up to be serving the community. I know that a lot of us in government are forming up task forces and task committees and community engagement groups and town hall meetings. And we rely on our trusted community leaders again and again to be volunteers to serve our community. Let's call someone up so that they can lead this discussion for us. And when you call that same community leader up 10 times a week, we need to compensate them for their services. And I think that is something that we need to include in the conversation, that we cannot rely on community leaders and our community partners to do this for free. If we're paying someone to do the work, in other ways, we have to pay our community members for the work that they're doing for us. And so I think that is really important to be included in the conversation, and those conversations need to have at the highest levels of government. No longer are we going to ask someone in a staff who speaks different languages to do the interpretation or translation for us and pretend that that is done. We need to hire them and compensate them. When you ask someone to come and do a video for us in a different language to talk about the importance of COVID-19, we need to find a way to compensate them for that, not just paying for their transportations, but actually for their time and talent. So I just want to bring that into the conversation as well, that we have to value a community for the value that they bring.
And one of the outcomes of these relationships, you're going to actually get some of these people that you're engaging that may want to be elected officials. And now the policy in the jurisdiction will be reflected by their experience and their relationship and their being part of the process.
Mhm.
Excellent. Thank you all for responding to that. That was great. I want to take a moment to, we've touched a little bit throughout the presentation on the pandemic and you know, the restrictions and things that everyone is going through at their respective locations. But a couple of questions have come in wanting to know, like, you know, the importance of getting to know your community's needs and their background and where they are currently. But can any of you speak to either some practices or plans that you have implemented or have seen implemented in gathering that and making that contact within the communities with all of the current COVID restrictions?
Oh, I was expecting Ellis to answer for some reason.
Actually, it was targeted to Ellis, so I didn't want to call him
Okay.
out on
I
that.
was like, this looks like an Ellis question.
Thank you, Anthony. One of the, and I'll use an experience in a different arena. I was fortunate to be director of the planning for the DNC in 08 in Denver, Colorado. Out of that process, we had 5 people arrested. That's significant because in many conventions, there are hundreds and hundreds of people arrested for exercising their right to demonstrate, et cetera. And one of the reasons we were successful is we brought to the table beforehand the attorneys. Now, when I talk about everybody has a role and responsibility, and our challenge to the attorney was, we don't want you to get us out of jail, we want you to keep us out of jail. So how can we do a plan that's going to represent a community that's almost triple in its size by people coming in, and we can do these things? Well, what we did, engaged the attorneys up front. We actually made they had street teams to go out, but we also brought in every protest group that wanted to march and protest. What are your needs? What do you want to accomplish from this event? And everybody wanted pretty much the same thing. They wanted their 15 minutes or 5 minutes of fame, and they wanted their group to see them going down for the calls at the 5 o'clock news. Okay, if that's what you want, we can do that. So everybody participated. They did what their job was. They put the handcuffs on and put them on a bus. And when the media left, they opened the back door, let them out, and they started taking pictures with the law enforcement, et cetera. And it was a non-confrontational experience. Now, flip that over to pandemic. What we're having in pandemic is it has been politicized. It has been brought to the point that if you on one side you don't wear masks, if you're on the other side you wear masks, etc. And we're not listening. We have politicians speaking instead of health professionals, and we have every state doing something different depending on whether it's a blue state or a red state, and people are actually confused on who to listen to. And it's become so political that it's damaging the capability of a good response in our communities. So what we're having to do from what should be done, I'm not working this directly, but what should be done is look at it from a bottom up to meet the needs of the top down. And let's do the plan accordingly. Let's look at, people can go to school if we are confident that the schools are safe. I don't want to put my kids in a school that I don't think they have done the due diligence to protect my son. I have a grandson that I want to make sure that they are not put in an unsafe situation. And there are rules and standards and resources out here to be able to do that in a safe way and not make it a political process and get everybody on board. And, you know, we don't smoke in front of people because there's a penalty associated with it. We wear our seat belts primarily because there's a penalty associated with it. And now we're asking folks to just wear a mask to protect your loved ones and you be protected from others. And that has become such a hot potato that we don't know how to, or the country has not overcome it yet. So I think when we're talking about pandemic, if we can just get to that point of people doing those socially correct things. There was a time in our history when doctors didn't wash hands and people died from infections more so than they did whatever was ailing them. And now you see that certain things done. You can't fly almost without disrobing, and we've accepted that. Now pandemic impacts a lot more people, but we're going to have the conversation to the point that wearing a mask is not something that's going to end at the end of the year. It's going to be a new culture paradigm shift that we're going to have to deal with. And the more people do it, and there's some reports out that if 90% of the population did it, it would reduce deaths by 60%.
Mm-hmm.
Long answer to a short question, I'm sorry.
No, that's a good response.
Anyone else have anything to add to that?
I guess we all could, but I think that is a great response because when you are handling a disaster of this magnitude, and many people don't realize how political emergency management is, and disaster response is very political. And so when you have that level of interference, it interferes with the response and the safety and protection of the public, of the community. So in terms of being able to coordinate the community during a crisis such as this, and understanding that safety must be at the forefront, that it is paramount, it can be very challenging, but this is where innovation has an opportunity to show itself. So looking for ways to connect with the community outside of the normal town hall or outside of the normal tweets to get information to people is going to be really important. So that would be the response. It's an opportunity to look for innovation, and it will show up.
Excellent. Well, I have to say we have had a robust conversation, a robust Q&A, and there are so many other questions that have come in, and we could probably keep going, but unfortunately we have reached our end. I want to thank everyone for joining us today, all of our speakers, Chancia, Brittany, Ellis, Z, Greg, Antoine. You all have made a great contribution to this conversation. It's obviously a very important one. So we really appreciate your time today. To all of our attendees, thank you very much for taking time from your busy day to join us. As I said, this is all being recorded. It will be shared with you probably within about 48 hours. So look for this coming back into your email. And if you have any other questions that you really want to get answered, feel free to reach out to us via that email, and I'll be monitoring that and do my best to get a response back over to you. So again, thank you all so much for joining today. We really appreciate it. Have a great afternoon and a great rest of your week. Take care.